to all our viewers. Welcome back to NIH Continuous Medical Education, organized and brought to you by the Sector for Health Information Resources, Office of NIH Manager, NIH Malaysia. And today we are now live from our NIH studio in Setia Alam, Malaysia. And don't forget to click on the subscribe button and catch us on our latest updates and event. So today marks the second last CME series for this year, and I have a very beautiful speaker on board with me today to share her research findings with the public especially. So without further ado, take a look at this promotional montage first, and then we'll continue the session.
We understand that healthcare is not just a word, it is a way of life. A health system consists of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. Like any other system, it is a set of interconnected parts that functions together to be effective. Health systems research provides scientific evidence to policymakers and health managers to enable evidence-based decision-making. At the Institute for Health Systems Research Malaysia, IHSR, we believe that research is the key to improving health systems and healthcare delivery, which is at the very heart of improving the health of the population. We are a group of multidisciplinary researchers who aim to provide evidence to health managers and policymakers at all levels. Our aspirations fall into 4 pillars: enhance our capacity and capability in health systems research, strengthen our alliance with local and international partners, promote and advocate translation of knowledge, promote research uptake. IHSR has 6 centers: Center for Health Outcomes Research, Center for Health Equity Research, Center for Healthcare Quality Research, Center for Health Economics Research, Center for Health Policy Research, Center for Health Services Research. We conduct research for evidence-based policy, continual learning, and consultancy to achieve the aspiration of the Ministry of Health, a nation working together for better health. Let's deep dive into the 3 core aspects to understand further. In research, we collaborate with our stakeholders to improve quality and deliver more equitable healthcare services for the attainment of better population health. We conduct research methodology continual learning program to a diverse range of health professionals. We have trained healthcare professionals and support staff in health policy and systems research. We provide consultancy by our subject matter experts, including research methodology and technical advice at local and international level. Let us go deeper into the past and present work, be it locally and globally. We advocate for health system strengthening. Our research area revolves around WHO health system building blocks. Here are some of our research examples. Through our continual learning, we are able to continuously build competency and capacity in research and quality assurance, quality improvement, empowering others to strengthen the health systems. In our core aspect of consultancy, we can see our achievements clearer within our various on-the-ground consultancy services, where we go to different stakeholders and practitioners in the healthcare system. We aspire to continuously build capacity in health policy and systems research, and taking evidence further. A well-functioning health system working in harmony is built on having trained and motivated health workers, well-maintained infrastructure, and a reliable supply of medicines and technologies, backed by adequate funding, strong health plans, and evidence-based policies. We open our doors to any fellow collaborators from all over the region and world to partner with us as we bring the Malaysian healthcare system to the next level. Because health should be something which does not see borders or geographical lines. Health is for everyone.
welcome back. Just a quick reminder for those who just joined us, do register yourself in the link provided in the description section. And if you have any question, also click on the link in the description section and type in your questions, and I will read your question towards the end of this session. And you will get your certificate of attendance within a week after this session. All right. Like I said before, sitting next to me is the presenter for today, Dr. Sarah Nurain binti Muhammad Noor, and she will talk about her research findings for her research entitled Dialing for Data, Overcoming Challenges in a National Health Survey. All right, so let me give you a brief introduction about our speaker today. Sitting next to me is, like I said, Dr. Sarah Nurain, a medical officer at the Center for Health Equity Research, Institute for Health Systems Research, or in short, IHSR, National Institutes of Health, Ministry of Health, Malaysia. She earned her Bachelor of Medicine and Bachelor of Surgery, MBBS, from the University of Kuala Lumpur, Royal College of Medicine, Perak, UniKL, RCMP. And before she sits in her current role at the IHSR, which she joined in 2018. She gained her clinical experience by working at Hospital Putrajaya for about 4 years, and since joining IHSR, she has actively contributed to several national research projects, including the National Health and Mobility Surveys for Healthcare Demand Module in 2019, as well as the Orang Asli Health Survey. And her primary research interests focusing on Sustainable Development Goals, SDGs for health, universal health coverage, and health equity. She had presented her papers and study findings in various scientific conferences and events, and her research delved into health system area, which may have impact to the policy change for the ministry generally. And we are privileged to have a very pretty Dr. Sarah with us today to share her insights and findings. So please join me to welcome Dr. Sarah. So I'll pass all the attention to you now.
So, thank you very much for the kind introduction, Miss Eliana. Selamat pagi dan Assalamualaikum. Saya Dr. Sarah Nurain binti Muhammad Noor daripada Institut Penyelidikan Sistem Kesihatan ataupun Institute for Health Systems Research, IHSR, based in NIH. So, izinkan saya untuk berbahasa Inggeris dan juga campur-campur sedikit Melayu lah for this sharing session. I call this sharing session je lah.
Yes.
Yeah, so it's truly an honor to be here and share my experience in conducting a national survey by phone. So hence the title, Dialing for Data, Overcoming Challenges in a National Health Survey. So these are the outlines of my sharing today. First, I'll talk a bit about the introduction of the study that we've conducted, the preparation that goes behind it, and the insight scoops of the challenges and approaches that we have implemented to overcome the challenges, and some take-home messages for future researchers. So before we deep dive, allow me to provide a brief context of the study conducted. So this is a study called National Health and Mobility Survey, or commonly known as NHMS. It is led by the Institute for Public Health. It's a nationwide population-based survey that provides information on Malaysia's disease burden, health problems, health needs, and expenditures. So to put it in context, this is a national study focused on collecting these data from each state in Malaysia to ensure representativeness of the diverse population that lives in Malaysia, and facilitate with these data in the hopes of facilitating the policymakers to make informed policy decisions. So NHMS comprised of non-communicable disease module, or NCD, and healthcare demand module, or HCD for short. So for us, it's HCD lah, kita
short form
guna yang tu. So HCD module, we are able to gain insight on the population's health status, health seeking behavior, and how health services were accessed and utilized. So it is NHMS ni initiated in 1986 by the MOH. Healthcare demand module has been an integral part in the last 4 decades. So traditionally, from 1986 until 2019, healthcare demand module data collection was conducted by face-to-face. Kita pergi ke rumah orang, kita jumpa dengan isi rumah dan kita interview waktu tu dan kita akan masukkan data. Over time, it has changed from paper-based kepada tablet. So, walaupun kita pergi rumah orang, kita masih menggunakan tablet untuk masukkan data. However, for the first time in 2023, healthcare demand module shifted to computer-assisted telephone interview, or CATI for short, implemented for data collection. So what is CATI? CATI ni is a telephone survey methodology where trained interviewers telephone respondents and then administer surveys using a script and directly enter participant responses into a database. Macam remote lah, kita dekat sini tapi kita call kan. So in comparison to face-to-face interview, although CATI surveys are typically fast and inexpensive, limitations has also been reported. So what I'm about to share is not going to be the details of healthcare demand module, but rather sharing the reflective experiences of our team on the challenges encountered when using this method for the study, as well as approaches we employed to overcome them. First and foremost, the preparation of all. So this survey, as I said, consists of 2 modules. So there are 2 main teams for each of the modules. NCD or kita panggil field team yang akan turun padang ke rumah-rumah ni, dan juga KATI team ataupun healthcare demand kita lah. So to operationalize KATI ni for the first time, so a team of 6 core members trained 17 KATI supervisors and 20 data collectors. So training was done in series and most were done before the survey started. So several trainings were conducted before the actual survey. Contohnya seperti yang di tengah-tengah tu, introduction to the module itself to familiarize the KATI team with the survey. So kita akan ceritalah EB ni macam mana, EB tu apa, kita akan familiarize everyone with the study from A to Z. And we also provide training on how to administer the survey by REDCap system ataupun nama panjang dia, Research Electronic Data Capture System. Dia can be used as a web-based ataupun tablet-based. So the field team uses the tablet-based dan kita di sini menggunakan web-based. So field supervisors dengan kita punya data collectors were also exposed to the flow of the question and their loopings. So beberapa question tu setiap loopingnya berbeza. Jadi kita mesti that's how we familiarize them with the flow and everything so that it would be smooth survey insyaAllah. So KATI FS field supervisors were also exposed to data cleaning and data analysis earlier, just to help them to understand better on how these data collected are going to be analysed. So the initial recruitment of eligible respondents was conducted by the field data collectors, which is the NCD team, who went from house to house to collect data for the NCD module. Okay, bayangkan mereka turun dan mereka dapatkan data seperti ambil darah, tanya mengenai penyakit kepada rumah-rumah yang terpilih ini. Pada ahli isi rumah lah. Kalau rumah tu 10 orang lah. Kalau 2 orang lah. So it was done by face-to-face interview. So after they are done with collecting NCD punya data, they will ask the same isi rumah untuk ask for their consent untuk participate in our module, healthcare demand module. So they will explain that beberapa tujuan healthcare demand module dan juga healthcare demand module akan call them in a few days time. So if they have provided that consent earlier, so it will be sedikit mudah lah bagi on our side to call them in a few days later. So subsequently, line listing of the consented respondents were provided to us. Before they even give us the line listing, they have to undergo a few steps. So initially it took about 7 to 10 days to receive the line listings of names, and because of the field team, dia gerak dulu. Mereka gerak lebih kurang 1 minggu atau 2 minggu lebih awal daripada kita. They get the consent, they line listed it, and then after some verifications, they will provide it to us. So, but all in all, we carried on the data collection period from July to October 2023. Then, after we get that line listing, kita akan call household yang terpilih tu dan yang telah consent, confirming the consent, and proceed with the survey if they nak proceed lah. So we use a validated bilingual structured questionnaire, and then we masukkan dalam database. So next I'll be sharing the inside scoops of the study, what we did when we faced the challenges that we may or may not anticipate, and how did we overcome them in the next slides. So you have to know that in any study, there will be some challenges that will be faced, whether we anticipate or not kan. So first thing that before kita dah ada that preemptive step sikit sebelum mula, because it is a phone interview and everyone was relatively new to the KATI method, including me. So we took some preemptive steps to help ease the data collection process. So selection of data collectors involve those who have multi or bilingual languages, preferably Mandarin, Tamil, Chinese, Melayu dan juga bahasa Inggeris. So we all know that Malaysia is a multiracial, multicultural country. So local dialects pun penting bagi pemilihan data collectors ni supaya, because we won't know who's on the other side of the phone. So kadang kita cakap macam biasa, tapi dia tak faham apa kita cakap dan kita pun tak faham apa dia cakap kan. So
You will need translators.
yes. So alhamdulillah, in that sense, we have a good team of diverse multi languages data collectors to help us in that sense. And then also with those who have past experience in telemarketing and sales will also taken into account to be selected as Kati data collectors. And also kita ada tanya juga, are you comfortable during the interview itself with the data collectors? We tanya, are you comfortable enough to be talking to other people over the phone? And what are your expectations and concerns? Kita pun bagi tahu kita punya expectations supaya disclaimer siap-siap awal-awal. Tak adalah dia orang jump into something that do not know. And then also bonus points if they have past involvement in NHMS or community survey. Another preemptive step that we took was to facilitate monitoring of data in and out nanti. So we've developed an online monitoring dashboard monitored by the core team here and served as a live database so that data collectors can enter live updates of the current call status. Macam dia call, tak dapat, dia akan terus update dalam tu dan field supervisors akan tahu. So this dashboard included socio-demographic data of respondents, which household they belong to, and who were the callers, and to ease the tracing back and should we need it lah. And then to reduce data entry errors, a 2-step real-time verification for checking respondents and answers were performed. Contohnya, bila satu responden sudah habis jawab, then checking tu akan dibuat oleh satu field supervisor. Dia akan check betul tak. Sebab tu training daripada awal supaya mereka ni familiar daripada awal sampai habis soalan tu. So mereka tanya dan jawapan dia tally tak. So lepas check yang tu, another step was from the core team. Core team pun akan check juga jawapan-jawapan ni. So it's a very banyak layer of checking over there to just to ensure.
How did you check? Sebab kan macam akan ada recording ke untuk phone interview tu?
Oh, unfortunately recording kita tak buat.
So macam mana field supervisor check semua tu? Okay. Double check the information tu.
Okay. Biasanya pada awal tu kita akan ada few simulations dulu. Simulations before calling the actual respondents. So kita core team dan juga field supervisors akan dengar apa yang dipertuturkan dan kita akan waktu tu kita akan address lah if ada cara salah tanya ke. Macam ni cara tanya, oh kena flow dia macam ni. So over time mereka dah biasa dengan benda tu dan it naturally flows macam tu je. Sometimes they don't have to follow the sequences pun. They can follow. So verification tu diperbuat bila once dah habis, field supervisors memang akan sentiasa ada kat situ untuk tengok. Dan kalau ada anything issues ke apa, mereka akan raise their hands and then kita verify waktu tu lah.
Which mean they are well equipped before data collection starts lah. Okay.
So verification tu dia akan sekali field supervisors lepas habis that shift and then core team akan take over macam after that core team akan check the line listing tu.
Okay.
So challenge 1 is now we are going to challenge kan. So challenge 1 that we faced was incomplete or incorrect phone numbers. So kadang-kadang number yang kita call tu tak cukup satu nombor, kadang nombor salah, kadang-kadang kita call dia dapat number, kita call tu tiba-tiba
orang lain yang jawab.
Tiba kedai. Contoh, dia bukan rumah, tiba kedai. So kita bila dapat macam tu kita akan try to trace back the line listing and hard copies of consent with the field team. kita akan liaise baliklah dengan field team. So, but this will require some verification lah from the field team to ensure that data is correct and double checked. Usually memang kita akan dapat baliklah number tu. So for incorrect,
which mean the field team tu dia akan pergi catch up
yes,
those yang termiss tu.
Betul. Sometimes if they are in the area, they will try to go back to the house and ask. Sometimes dia akan tanya balik, call balik.
Betul ke number ni?
Betul.
Okay.
So to that extent kita nak ensure.
Nak kejar you punya respondent.
Nak kejar respondent tu kan. So for incorrect phone numbers kan, sometimes kita akan, contoh kita call, okay, dalam line listing tu ada contoh ada 4 number. 4 number ni satu rumah lah. Mak, ayah, anak, atuk contoh. So number atuk ni tak betul. So kita akan, alang-alang kita call ayah atau mak tu, kita akan tanya, betul ke nombor telefon macam ni? Macam tu. So the confirmation with other household members and also data collector ni tanyalah who are the person that you are talking to, or is there someone else. Contoh kalau tak layak untuk masuk, contoh dia bukan ahli isi rumah tu. So kita nak jadikan layak kriteria untuk menjawab ni pun mempunyai beberapa kriteria. So kalau dia bukan layak, contoh dia bukan tinggal pun dekat rumah tu, so kita tanya, is there anyone eligible to
enroll
answer
dalam study?
Betul. And then next challenge is from the respondents, meaning they did not pick up the phone or they refuse to participate despite giving initial consent, and sometimes they did not even remember that they gave the consent, or kalau mereka menjadi proxy, contoh macam ayah atau ibu menjadi proxy pada anak-anak yang kecil yang tidak dapat jawab, mereka tak dapat recall anak dia sakit tak 2 minggu lepas, ada anak dia masuk hospital tak, macam tu. And then some of them gave reluctant answers. So this reluctant answers ni, this was a bit of a hurdle juga, because kita fahamlah kadang-kadang kita call waktu mereka bekerja, waktu mereka tengah sibuk nak ambil anak balik tadika. So those yang bermain masa ni agak susah lah. Sometimes we even ada yang baik hati cakap, okay, telefon saya malam lah, saya free malam.
So you punya team call Kati team malam pun kerja?
Betul.
Oh,
kita ada 2 shift yang buat pagi sampai petang dan petang sampai malam. Tapi malam tak adalah 24 hours. Dia ada certain cut off date.
24 hours tu call center pula.
Itulah. Okay. So even weekends pun kita ada juga
make phone calls.
Yes, make phone calls, because we realise that most of these people yang bekerja lah especially, dia free waktu weekend kat rumah. So dia akan tend untuk jawab. Kalau dia bekerja waktu ni, kadang-kadang kita pun tak anggap pun kan kadang-kadang.
So your punya rejection rate sangat rendah lah, because you catch all your respondents.
Tak juga, because we have because in line with other studies juga, response rate is about 3 to 35%. So kita dapat 26.5%, which is in line with other studies. But it's also noted that memang KATI or phone-based interview will yield that range of responses. Okay. So what we did, untuk orang-orang yang tak pick up the phone ni, kita try multiple call attempts. Usually the set standard was 3 to 5 times lah. But sometimes our team is, memang saya salute lah team, memang dia akan call more than that. Sometimes they even keep the phone number sekejap and they will call next week. Macam tu. Inisiatif mereka sangat baiklah, and repeat the call during mopping up session. And then for those initially refuse, kita pujuk dan persuade household members tu. Sometimes mungkin mak je setuju, ayah tak setuju. So kita akan pesan dekat mak tu, boleh tak pujuk ayahnya untuk menjawab sikit je macam tu. So and sometimes kita juga, untuk those yang tak remember tu, kita akan cakap lah, ingat tak last 2 weeks ada satu team turun rumah, jumpa, ambil darah puan, pakai baju KKM, dan macam itulah. So dia akan mudah untuk recall. So untuk respondents yang refuse sudah, walaupun memang diingat kita datang dan they still refuse, kita ada juga provide clarity and reassurance during the calls. So kita akan cakap lah, this is our modus operandi, this is the tujuan of kajian, and then speak to FS. Sometimes bagi yang tak percaya tu, we even ask them to check the brochures, check the websites of NHMS, the Instagram bagi mereka yang ada social media lah. So okay, For those next is yang tak ingat pun, yang tak ingat sebab mereka menjadi proxy ni, mak ayah ni. So kita akan tanya satu-satu. Contoh anak dia ada 4, kita akan tanya satu-satu. Sometimes kita breakdown macam okay, saya tanya 2 orang hari ni, 2 orang esok.
Okay.
Macam tu. Tapi biasanya kita akan habiskan lah.
One shot lah.
Yes, one shot. And then sometimes kita akan tunggu actual guardian yang ingat. Because usually bapak-bapak tak ingat.
Mak selalu ingat.
Mak yang selalu ingat contoh kan. Okay, so and initially respondents were suspicious when we tried to confirm some personal information. Contoh macam IC is a unique identifier for age kan. Contoh macam kita nak tentukan, kita nak confirm kan betul ke you umur 70. Sebab because some questions have cut off age. 13 years old baru boleh jawab, 18 years old. So kita nak that IC untuk confirmation je. But we understand that those are sensitive questions for them. Kita pun kan tak comfortable. So over time kita overcome with simpler things like can you give me your birth date, or just simply can you give me your age. Usually age ni susah bila dia border lah macam 17 nak naik 18 ataupun dia dah terlalu tua untuk ingat. So kita akan guna alternatif macam tu lah. And then from the interviewer side, after some calls were made, they sometimes would face communication fatigue. Macam burnout lah. Yelah, kita call 50 orang sehari, kita pun penat juga kan. So because they having to ask the same set of questions to a number of people, it can be tiring. Or sometimes on not so lucky day, they get rejections one after another. Hari itu adalah hari rejection.
Get scolded tak?
Get scolded tu itu biasa. Ini kenapa ni hari Sabtu kerajaan kerajaan takkan ada ambil call hari Sabtu, urusan kerajaan tak ada hari Sabtu, macam itulah contoh. And then some of them very out of script respondents ni lah. Contohnya macam angry ataupun oversharing. Satu respondent takes about 30 minutes, even 1 hour to finish because they overshare, terlalu friendly.
So you have to listen lah. Your caller tu.
So kita nak data dia. Tapi sometimes over time our data collectors pandai navigate. Macam okay, kembalikan mereka balik pada soalan yang nak ditanya tu.
Boleh tak doktor explain sikit for that over script part tu?
Okay, out of script tu contoh macam kita ada this actually it's sort of like tough respondents lah. Tough respondents ni macam saya cakap tadi, dia angry, dia disengage, dia tinggi suara, dia not very cooperative.
Even kalau disengage, you akan call back ke?
Yes.
Very perseverance.
Yes, that's how we have to because every data counts. So we have to try our best to call them up. And tapi kalau memang tak boleh juga, kita memang pasrah dan move on lah.
Move on.
And then also there were occasions where one of the RAs had a caller had called someone, then that someone is slightly too over friendly.
Okay.
So that's itu pun satu challenge juga bagi kita sebab after phone tu kita letak, we have to this person is macam quite shocked. So kita kena macam tenangkan dia dan cuba untuk confide in dalam keterkejutan dia itulah. Okay, then regarding scammer issue ke apa, they need to be convinced despite giving brochures and check websites and other sources.
Of course, kalau call weekend takut orang kata scammer kan.
Betul.
So what is your punya follow up kalau kata you scam I ke? Adakah you akan send macam follow up messages ke ataupun email yang kata no, kita tak scammer, kita team yang datang 2 minggu lepas bla 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 macam tu?
Okay, so one of the limitations of our study is that we don't have that WhatsApp special yang macam boleh hantar
follow up punya WhatsApp.
Betul. Macam kita tak boleh macam preempt dia orang dulu yang macam kami akan call sekian macam schedule kan. Kita belum, itu limitations kita lah waktu tu. So points for improvement insyaAllah nanti. And then kita try untuk cuba untuk convince diorang lah. Macam tadi cakap tadi, website, minta diorang buka website, minta buka Instagram official and SMS. And then during masa field team turun pun, mereka ada serahkan brosure. And mereka ada juga, sebelum ambil consent tu pun diorang akan terangkan juga sikit mengenai tujuan study kita tu. So sebenarnya banyak dah cara yang kita cuba
untuk elakkan scammer punya tagline.
Betul. But we faham lah. Even kita pun kadang nak angkat phone pun risau kan.
Nak kalau unknown numbers kan.
Yes.
So kita takut lah macam tu.
So untuk tu we had some untuk interviewer yang rasa down, yang ada rejection syndrome semua ni, macam tadi kita ada regular feedback sessions dengan team and data collectors. Kita nak encourage them to express it if they are feeling fatigue or feeling down. And then we also schedule rotations and 2 shifts, and they were given in between breaks for them to catch a breath or whenever they feel overwhelmed. And then also we provide a self-progress diary to keep track, like a diary lah. And then for notes for them to put in. But to our surprise, this promotes healthy competition among them untuk, okay, hari ni saya nak habiskan kuota banyak ni. Hari ni saya nak banyak ni. Maksudnya it's a good ni lah.
Dia ada limit ke untuk diorang satu hari kena berapa orang?
Tak ada limit.
Tak ada.
Tak ada maksimum lah.
Itu macam KPI untuk telemarketing pula kalau macam tu kan.
Kita faham macam kan macam-macam kerana orang kan. Jadi macam kalau nak letak satu hari mesti complete 50 calls pun sometimes it's susah.
Sometimes macam doktor kata kalau ada seorang tu overshed, dia dah
dia dah drag all the way.
Betul.
And then not so lucky day, reject after reject, member pun jadi penat. Okay, so we were fortunate that in that sense because our RAs, our data collectors and field supervisors have developed their own buddy system. Buddy system yang macam dia akan for those who need help, and this creates a very harmonious team lah. Meaning kalau you tak cukup, I tolong you, like that. Tak ada memang harmoni lah. Alhamdulillah, itu rezeki buat kami lah. So because they are the ones who are facing all sorts of kerana kan orang hari, so as much as it's important for us to collect data on time, it's also important for us to take care of the team. So next challenge is handling nationwide data collection with limited human resources. So this is also a challenge in KATI, which include familiarizing with KATI method. So overall, there were only 20 data collectors for all 16 states of Malaysia, and with an average of about 15 to 20 calls per day for each person, and which carried about 400 calls per day sepatutnya. But in reality, not all calls were successful at first attempt kan. So, and with limited human resources, familiarization is key to ensure smoothness of the survey. So, to help them with familiarizing with KATI, as I mentioned before, we had training sessions before the survey for exposure and exercise, and a specific manual on how to use the caller system with multilingual scripts. BM, BI, Mandarin and Tamil were provided. Mandarin and Tamil were provided by our FS, our field supervisors, who translated the script into Tamil and also Mandarin. So we also had simulation of calls prior to engaging real respondents, and we encouraged them, because this over time this develops skills to interpret the tone of the respondents so that any confusion or discomfort can be rectified and addressed. Because kalau face-to-face interview, kita dapat tengok verbal cues dia, yes, dia pening ke, dia kerut ke apa kan, kita dapat address. Tapi when over the phone, it's not the same because we don't know who's on the other side. So that's why we try to train them to try to interpret the tone of the caller, of the respondents. Okay. And then next is familiarizing ourselves in a short span of time with the web-based red cap system. Was also challenging because sejujurnya memang semua it's the first time for everyone, so we anticipated that phone interviews cannot be too long, and so questionnaire were modified in a way that to suit the KATI method and convenient for data collection as well. So we have pilot tested multiple times prior to the survey this red cap system, bila masuk nak tekan apa semua tu. And had simulations also to ensure the smoothness of survey. So just to set it correctly, to be foolproof. It has to be concise enough, but enough to measure what we want. So simulations, we found that simulations help the way they converse that the flow would be more natural and convenient for both respondents and interviewer. When you have had multiple times doing the same thing, you sort of like tahu which question comes next kan. So sometimes these data collectors, they don't follow the sequence. They just tanya apa yang ni and then later dia akan put macam tu. So it helps respondents pun tak rasa macam terlalu automated dan robot kan. Okay. So, despite the challenges and approaches done to overcome them, by the end of data collection, a total of 9,177 respondents were successfully interviewed. So, this figure is, like I said, comparable to response rate reported from other studies that ranges 3 to 35%. So, the challenges or barriers that we encountered are similar to barriers that have been reported by other studies that use CAR-T. For instance, the delay between field encounter and the phone interview, which can be long, may have influenced the respondent's decision for participation. So possible reasons may be due to loss of interest or not available. So people need to know, one thing that people need to know I think the audience need to know that it's not as easy as it looks. When you get the consent from the field team, meaning field team dapatkan consent daripada respondents, multiple steps were involved to ensure that the data line listing tu verified before given to us. So that's the gap that, but the time that's taken may be long because of that verification process.
So it will delay your
that will delay the
your
study.
process.
Yeah, so that's the gap that we think should be further explored. And because window period tu penting kan, so kita nak dapatkan sebanyak mungkin lah. And then additionally, as we all know, in our current setting, phone scams are becoming a big issue, which may deter them from participating in the survey. So because in an internet user survey by MCMC in 2022 reported that most common type of cybercrime was fraud or scams, with 98.5% of respondents reported that they have experienced it. So kita pun tak boleh blame society juga because of these emerging scams kan. So what we can take home from this is that the potential in phone interviews and growth in digital health make it important for researchers to understand that there are alternatives of face-to-face interviews such as CAR-T.
Ada negara lain tak yang guna this kind of CAR-T punya approach?
Ada. For instance, the United Kingdoms have been using, but then again, their dynamic of the population and also the taburan dia berlainan sikit lah berbanding kita kan. Macam kita, especially for those live in rural, such as Sabah, Sarawak, sometimes they don't have access to even a phone.
Yes.
So that's the limitations of CAR-T lah sebenarnya.
Okay.
In relation to scam concerns, strategies to increase awareness of CAR-T prior to the survey, such as through mass media, should be considered, because awareness is key so that they know such a study is being done and gain people's trust to participate. Because kita tahu yang people fear what they don't know. So to gain the trust, we need some form of promotion on mass media. And okay, and next take-home message is continuous monitoring. Because what we did by that continuous monitoring, we found that particularly in methods such as CAR-T, allows real-time checks and balance as well as tracking progress, making it easier to identify and address issues promptly. And this is the most important because the huge component of CAR-T is actually people. It's not the machines, it's people, the respondents and also the data collectors. So this can range from data collectors, field supervisors, core team, and we managed to navigate the dynamics and challenges during this CAR-T period because we had each other. So to achieve what we intended to measure, it is also important to have a good and harmonious team because we could not achieve all of this without them, the CAR-TFS and the RAs. So these are my references. I would like to acknowledge and give thanks to the Ministry of Health, NHMS 2023 Steering Committee and the MOH stakeholders who have been with us from the start until finish, the Director of IHSR, the Healthcare Demand Team, CAR-T Field Supervisors, CAR-T Research Assistants, huge thanks to you, and also Director of IKU, Principal Investigator of NHMS 2023, Central Coordinating Team, Field Supervisors and Field Research Assistants as well. So last but not least, hashtag kami bukan scammers. We are real people, real conversations in the efforts to sustain and strengthen healthcare delivery by the MOH. So thank you. This is us, but not all. Ni yang sempat
So
kita
where are you?
tangkap. Adalah paling hujung sekali.
Ya, nampak dah.
Yeah. So again, if in the future kalau ada lagi yang research macam ni, insyaAllah we will do much better and improve version. So thank you everyone, and I'll pass the mic to the moderator.
Okay, thank you, Doctor, for your splendid explanation. Again, I would like to repeat a quick reminder for those who just joined us. Register yourself in the link provided in the description section, and if you have any questions, key in your question also via the link provided in the description section, and you will get your certificate of attendance within a week after this session. Alright, so I may now open the floor for Q&A since we have a little bit of time. Okay, so Doctor, are you ready to take the questions?
Okay. Kita cuba.
Okay, kita cuba ya. Okay, soalan pertama saya ni daripada saya lah. Okay, do you think Kati will be able to replace the conventional face-to-face interview for a nationwide survey like this?
Okay, in my opinion, to get the best level of information, it's still best to talk in person. Even generally kita tahu pun a face-to-face conversation is better than over the phone kan. So we can
kita akan nampak the body language, the expression, etc.
The expression, the body language, the non-verbal cues, and actually we can, kalau orang tu kita boleh terus probe terus, kita boleh terus explain maksudnya macam ni. So even if it's not specified to this study, I think face to face is still best to get the best level of information.
What kind of trainings that you give to your data collectors? Sebab dia orang yalah selalu kena kadang-kadang kena scold, kadang-kadang being mistakenly anggap as scammers kan. So di sebalik dia orang punya kesabaran, wisdom, what kind of training lagi you provide to them in term of knowledge to that dia orang boleh equip akan diserang oleh respondents ni macam mana?
There are no hard and fast rule. It's as we go along, kita improvise. Tapi to start with, memang kita ada that script yang start memang dengan ayat macam Assalamualaikum makcik, saya ni daripada ni macam tu. So bila dah lama sikit baru diorang macam dah tahu pasal ni, diorang akan explain, oh sebenarnya makcik soalannya nak tanya pasal makcik pergi hospital berapa lama, macam tu. So makcik tu oh ya ke, baru dia boleh proceed. Sebab soalan kita ni bukan sekadar satu macam tanya do you have this, and then jawapan yes and no. Tak. Kita ada banyak layer of soalan. Contohnya lah macam outpatient care utilisation, penggunaan penjagaan kesihatan luar. So kita akan tanya, did you use this, did you go to outpatient healthcare services in the last 2 weeks? Dan dia jawab yes. Then ke mana? Then pergi buat apa kat sana? And then ada bayar ke? Dia banyak layer tau. So nak get the attention of the respondents, it's quite a challenge jugalah. So saya memang bergantung pada kebijaksanaan data collectors dan field supervisors actually untuk guide through this.
Macam mana doktor screen the data collectors, hire them as data collectors tu? Macam mana doktor screen diorang untuk hire?
Kita screen dengan first memang kriteria yang paling penting adalah they have multi language punya abilities lah. Sebab sekejap lagi nak orang yang di sana cakap contoh bahasa utara, yang kat sini tak faham, ataupun bahasa Kelantan, yang sana pun tak faham. So kita memang
so the Kelantanese do the interview for Kelantanese macam tu?
Tak semestinya, tapi memang kalau macam contoh very remote areas, sometimes they have that language barriers. Contoh Sabah Sarawak juga. Some of our data collectors can speak, and also field supervisors kita ada memang orang Sabahan ke apa, so they can assist in that sense. They can assist in that sense. They are the ones who call. And it's not just data collectors calling them, it's field supervisors calling them also. So memang
so they got multiple call.
Yes. Macam contoh memang susah, memang supervisor akan call. Kalau kadang-kadang kita tengok macam hari tu tak dapat banyak call kan, memang semua akan try call juga. Field supervisor pun akan try call juga.
Oh, okay, I see. Daripada doktor punya presentation tadi, what was the response rate for HCD in 2023?
2023 response rate was 26.5% overall lah. So
Which is itu consider okay lah.
I'm not going to say okay or tak okay, but according to literature from multi-country studies, it falls within the range of 3 to 35%.
So kita masih at par dengan diorang lah.
Yes, so because orang lain pun buat, dia akan dapat response rate yang sama. So kita rasa macam, oh okay lah. And then previously pun, HMS 2020, communicable disease, they get the same, around the same numbers juga.
Doktor ada any future plan tak kesinambungan daripada study ni? Instead macam next study tuju sekati ke apa ke?
Oh, it's too early to say. But I hope that whatever method that we are choosing in the next cycle, insyaAllah in 2028.
2028?
Yes. Dia akan dapat sebab aim kita satu je, kita nak data rakyat orang yang duduk di Malaysia, because kita nak give the best health service delivery. Kita akan cuba try to buat as good as we can. Kita nak cater those. So I hope in the next one we will get that try our best to get the good method untuk dapatkan the best data. But in my opinion, I still believe it's face-to-face interview.
It's the best.
Yeah.
Okay, so
because human interaction, right?
Yes. I'm sure.
But we faham lah that the limitations was sometimes resource, costly, timely, macam tu
so
lah.
Kati akan at least save kita punya human resource sikit kan?
Betul. Save a lot sebenarnya with the cost and everything.
So that's why mungkin lah, that's why kita suggest Kati. Tapi still sebab dia baru, dia mesti ada limitation here and there sikit-sikit kan? Okay, so non-technical punya question. During doktor punya conduct of the study, what was the biggest challenge that you and your team kena hadap?
Biggest challenge
Yes. Ada unexpected findings ke apa ke throughout the process tu?
Unexpected findings I would say it was a fun experience lah. Dia macam the challenge that we took, dia jadi macam tak ada yang biggest, macam semua macam
okay
sama
je,
tak adalah okay. Tapi macam okay bigger, okay ada lagi bigger macam tu. So kita tak ada yang I would not, saya tak pinpoint lah pada satu. Cuma yang memang isu scammers tu memang ni lah, memang tak boleh nak dielakkan lah.
So bila dah scam tu, do you think Kati boleh kita pakai lagi tak for next punya plan? Sebab yelah kita sendiri pun ada terima call daripada scammer kan. Saya pun macam saya tak nak angkat ni macam tu, unless orang tu hi saya sekian kan macam tu.
In my opinion, I think with like I said face to face, tapi we all know kan? Yes, we all know that times are changing. Kita akan move towards online, towards all the jumpa-jumpa sangat kan. And then with pandemic ke apa ke, those things come in handy lah. And then in the future Kati ni kalau boleh akan di-improve lagi, maybe perhaps some form of promotion over mass media, because awareness is key. Bila orang tahu, baru orang nak participate. So I think into good promotion wise.
Agak-agak kan in future boleh tak AI yang replace the data collectors over the phone to call the respondents?
AI, okay, contohlah kalau you dapat call daripada phone, tiba-tiba dengar suara AI, kita akan terus tak kan? So somehow I think it's human juga kena
macam machine lah yang jawab, tak nak lah macam tu.
Ni confirm scam letak kan. So I think somehow human interaction is important to them. Untuk Kati lah in the future.
Okay, kita tengok dulu ada soalan tak? Ada. Soalan dia daripada Puan Rahmi. After getting information about the examination and also the patient condition from data recording, so is it possible for the next recovery, and also the illness health therapy next time? Also the doctor specific. I think macam tak relevan, macam a bit divert sikit daripada kita punya topik today. Tapi mungkin doktor nak jawab ke?
Bagi saya baca sikit.
Sekejap. After getting information from the examination,
Okay, so is it possible for next recovery also the illness health therapy next time? Oh, okay. One thing is that kita ambil tapi kita tak boleh kita tak ada that our limitations is that kita tak refer next lah. Meaning kalau kita tahu macam ni kan, nak refer for therapy ke apa, tiada. Cuma yang saya tahu for NCD, kalau orang tu ada, kita kan ambil darah kan, diabetes ataupun hypertension, memang kena ada that one letter yang template dah khas, tulis nama and then kita chop dan minta patient untuk send pada nearest health clinic. But we cannot do that for them because it goes beyond macam privacy data lah. Macam kita pula yang bagi kan. So kita boleh suggest but we cannot do it for them. Kita suggest untuk they go to the nearest facility to get help, but we cannot do it for them lah. That's our limitations.
Okay, I hope that will answer a bit of your query kat situ. Okay, saya nak tanya sikit soalan yang macam mungkin kalau doktor boleh jawab lah. Okay, we know you have massive and extensive findings from this kind of national survey kan. Okay, we understand from this survey about our public concerns, public needs and their healthcare demands or whatsoever. Tapi from the findings, did the stakeholder pick up any of the findings? Ada policy change ke has been made since then? Macam tu.
Okay, policy change, it's
especially for a national survey macam ni lah.
We use this data untuk inform the stakeholders to make an informed policy decision lah. But to actually know that which one that they are using, it's quite difficult lah juga. Unless memang kita gauge that particular ni. But there are some yang memang they use in discussions. Memang they guna our data in discussions with other policy makers untuk help better in healthcare. But to know per se which one, I cannot say
pinpoint lah.
Yeah, I cannot pinpoint. But as a whole, memang dia guna macam contoh outpatient utilization, inpatient admission, semua tu healthcare expenditure, memang dia akan guna untuk
kita punya data daripada
untuk
national survey.
Untuk formulate another policy.
Because kadang-kadang public terfikir, okay, you conduct a survey. A survey is just a survey kan. Kita kan living in the world where everybody can give opinions, can throw out their ideas kan. Pada diorang, there's no right or wrongs kan. So macam, okay, I got a call, a survey, so what? Dia macam tu kan. So kita nak macam end the so what daripada public tu. So kalau boleh kita nak bagi pencerahan pada mereka yang okay, this kind of survey in a way ada benefit to them lah. Macam tu.
Contoh macam dental ke apa kan, dental program yang apa datang ke rumah, semua tu home visits. All of this come from this surveys lah, yang data yang kita nampak tak penting pun, tapi sebenarnya penting untuk diformulatekan even bigger decision.
Okay.
So, itulah.
Ada lagi satu soalan ke? Let me see. Okay, tiada. So I guess, we don't have time. Due to time, I think I have to stop the session here. Again, don't forget to click on the subscribe button for our NIH YouTube channel and catch us for our latest update. So, Doktor, thank you for teman saya hari ni.
Thank you mengajak saya.
And kita buat sistem pula sesi hari ni saya santai. Saya mencelah-celah masa Doktor bagi tu. I hope tak interrupt you ya?
Ya, tak.
Okay. So, until then, I'll see you guys next year. Okay, bye-bye.